We have affectionately referred to this 2022 spring release as the Season of Love. It's a fitting name because we're recording these videos the week of Valentine's Day. Our goal with each release is to continuously improve our software to make your experience just a little more joyful. This release includes a few big multi-release projects we'll update you on shortly. We also want to showcase where we focus much of our time, which is on improving the quality and the many small enhancements that make a big difference when you consider how they can improve so many workflow elements of your workday. We've listened intently, thought creatively, and built this release based on your feedback. 28 suggestions from Hub and 10 micro enhancements were submitted and incorporated into what you are about to see. We hope you'll enjoy all we prepared.
Our 2022 spring release is packed with many new features and enhancements. We are grateful for your ongoing feedback and suggestions. These are key to helping us continuously evolve our software in ways that make Advanced MD more user-friendly and intuitive for you. Our new Claim Attachments feature lets you attach supporting documents with a claim. You can track the complete status here. For example, you can add medical notes, images, labs, and diagnostics when sending unsolicited claims. Collections by Visit Worklist has been enhanced to include filters for payment reason codes. We also added new facility and provider columns and filters to help you more efficiently drill down into your AR to follow up on outstanding items faster. Data points have been added here in your work list. A few include provider name, NPI, and total claim amount. The referral card now gives you more efficient charge entry workflow. Professional, institutional, and EHR charge slips. You'll enjoy reduced time managing authorizations and faster time to collections. We have enhanced payment search. You can now edit deposit dates, filter by payment code, and export results to Excel. We have added a new ERA custom rule for more efficient payment processing of multiple insurance policies. You can now automatically process payments when a secondary or tertiary payer is present on a claim. Same-day roll-up of claims lets you roll up patient visits from multiple providers on a single day into a single claim by CPT, charge code categories, and carriers. We have added viewer permissions for other notes. You can now select who has access to sensitive patient information at the claims level. Our new Payer Agreement Gateway simplifies the enrollment process with one place to manage your EDI agreements. You can create, submit, and track statuses of your EDI agreements for claims, remittance, and eligibility. More easily manage your EDI agreements directly from our practice management.
A primary benefit of Advanced MD is our fully unified software bundle that automates so many aspects of your financial, clinical, and patient workflow. We are making significant changes to our EHR to ensure better interoperability of your patient data so you can more easily and accurately share information among providers, sites, and external entities. This release further improves your clinical efficiency and helps facilitate better communication between you and your patients. Height and weight from the most recent patient note or past prescription is now automatically added to all new scripts. This saves time and ensures prescriptions received at the pharmacy include the most up-to-date and clinically relevant patient information. We are excited to introduce a new patient card for prescriptions. Patient card is a software development term for this modern framework experience that makes screens with high densities of information more pleasant to view and more intuitive to navigate. This new prescription patient card is one of many upcoming prescribing tools designed to significantly improve workflow and simplify prescription management. Electronic prior authorizations are now available to all prescribers and help save time and stress by letting you request electronic authorizations for patients before sending prescriptions to the pharmacy. Completing prior authorization within workflow helps prevent mistakes and disappointed patients at the pharmacy. AdvancedMD has partnered with Dr. First to offer a robust patient prescription notification service. We now offer a unified patient SMS or texting service that includes pickup reminders, educational information, copay assistance, and discounts if available. This feature is aimed at improving medication adherence by addressing root causes of prescription abandonment. Multiple users can now work in the same note, make updates simultaneously, and all information is retained. When the note is saved, data is merged from all users and visible in your note. Providers can easily manage data conflicts to avoid data loss. User management has a new option to prevent clinical staff from accessing patients assigned to other providers. Access is controlled by those assigned to a specific patient care team. This feature lets you prevent unauthorized access to sensitive patient information. Gender identity is now displayed for providers in the patient chart for a more individualized approach to care. Providers can also view patient sexual orientation. To help your practice meet the ONC Cures Act information sharing rules, we have made it easier to share relevant clinical information with your patients in the patient portal. Chart folders can now be configured to automatically make all supported files patient viewable when saved. This eliminates the need to sign and mark visible to patients. Chart items that are imported, uploaded, and received through lab interfaces or fax can be shared immediately. We added a default folder for the narrative to be viewable in the patient portal. Providers can manage which items display. We have enhanced our CQM reporting with more transparency and flexibility. The individual provider report and group report can now include or exclude alternative billing provider codes. In an era of growing demand for self-service consumerism, our patient engagement products help you offer care whenever and however patients need it, even after hours. Our patient-facing applications are receiving some amazing enhancements, and many new features are aimed at helping patients more actively engage in their healthcare experience. Staying well connected to patients improves care outcomes, revenue collections, patient satisfaction, and greatly reduces the number of incoming calls to your office. At the core of patient expectation is a great telehealth experience. Based on your feedback, we are making major enhancements and unveiling a new telehealth solution. Our all-in-one telehealth platform gives you and your patients a fully unified experience within your familiar AdvancedMD workflow. This provider list view shows all your telehealth appointments. Patients can make an appointment online based on your real-time schedule availability. Reminders are automatically sent with session details and an evergreen link. What this means is the original link for the appointment will remain the same, regardless of how many times the appointment gets changed. The patient experience is now browser-based. There's nothing to install or download for you or patients. Providers can screen share with participants to better engage and share important health information and milestones. We now allow patients to upload the front and back of up to 3 insurance cards to the patient portal during intake or when self-scheduling. Patients can also upload a photo ID or driver's license. Once uploaded, these files are immediately available in the patient chart files. Our self-scheduling feature now gives you more control. You can allow or restrict existing patients to schedule with current or additional providers on their current care team. Provider matching has streamlined the scheduling process. You can search by holds associated with appointment types. Schedulers can search for providers by hold or by all available open appointment times. Our mobile apps are included for free. Our clinical apps help you better diagnose, track, and treat diseases. A patient kiosk app used in your waiting room lets patients complete intake electronically on an iPad. Our front office app lets you assign, review, and accept intake forms completed on our patient portal or patient kiosk. New in this release is our Connect Admin app to help you manage the administrative portion of your practice. It's available for iOS and Android. Access user management and stay connected to your practice from anywhere. You can directly receive system alerts that provide updates on the status of Advanced MD in your area. The app also lets you reset passwords, as well as create and remove users. Quick Renew, a popular EHR feature, has been added to our clinical app. You can now renew multiple medications for a patient in one step and select any you want to renew from a list. With one tap, a comprehensive interaction check is performed. You control when a prescription is ready to be sent. Last year, we introduced the E&M coder in our desktop edition to find the proper office-level visit using the new 2021 AMA guidelines. This feature is now available in our clinical app. The chart toolbar is now customizable. You can remove unused chart items and reorder chart tools to match your workflow. We thank you for your continued business and all your ongoing feedback. Your insights influence how we build solutions for your practice, workflow, and specialty. Enjoy these updates inspired by you.